Mr. Knox is an 85-year-old gentleman who was admitted to the hospital after a fall which resulted in a fracture of his right hip. He underwent successful ORIF and has been on the nursing unit for 2 days now. By his history, he has hypertension, hypothyroidism, osteoarthritis of the knees and shoulders, as well as prostatic hypertrophy and mild dementia. For the past several years, he has lived independently in a house next door to his daughter and her family. Over the past few weeks, his appetite has become less robust and he's not as steady on his feet as he had been.
Good morning, Miss McCall. How are you today?
Well, I'm good, but my father's just not right. This is not like him at all. Something's just not quite right. Just a little while ago, he's talking about being on an airplane. He never seems to really wake up. He just is so restless. At home, he's very active and he's up all day doing things, but this is not like him at all. I don't know what to make of it.
Mr. Knox, good morning. How are you this morning?
Leave me alone.
It's very important for a nurse to assess older adults' physical, cognitive, and functional status, especially when these may be different from their baseline. These may include vital signs, but may also be reflected in neurological changes, best detected in a brief neurological examination.
Mr. Knox, do you know where you are right now?
Family, caregivers, or past medical records can provide information indicating what their level of function may have been before they came to the hospital. Screening for delirium, also known as acute confusion, is part of this assessment.
All right. Can you open your eyes for me, Mr. Knox? Let me see that eyes. Open that eyes.
What are you doing in my house?
Well, I'm your nurse. You're in the hospital.
Who said I am not?
Now, Daddy, you know you're in the hospital. You had surgery, remember?
When did you get here?
I've been here all night.
Are you hurting?
Something happened to my hip. I have no idea. It's killing me.
Okay. I'll get you something for pain. Maybe that would help you and help you sit up, okay? Do you have trouble swallowing?
Not usually, he doesn't. Do you want me to hold his hand?
Maybe. Okay, maybe hold his hands and talk to
When
him.
did you get here?
I've been here all night, Daddy.
Okay.
All right.
It's okay, you can take him.
Okay.
I said that your dad is having difficulty paying attention. It seems he's more lethargic than he had been earlier. And I'd like to review that with my charge nurse.
Okay.
Okay.
She is a geriatric resource nurse, and
Do we have
maybe she'll have some perspective about the changes we are seeing. Sandy, have you got a minute?
Sure.
I can't sort of confused on Mr. Knox in room 646. Yesterday, we gave him 1 milligram of morphine for his incisional pain and Tylenol once in the evening. And he hasn't received anything else since then. And I heard last night he was very agitated. Night shift gave him 2 milligrams of Ativan IV.
They did. That's an awful lot of Ativan for someone his age.
Research has shown that using low-dose Haldol is safer and works better in controlling agitation in the elderly than other agents like Ativan.
Pain may be a significant factor and cause of his delirium because he didn't get very much anesthesia during his surgery. We could talk to his doctor about starting the geriatric acute delirium plan for him, and that's got the geriatric pain management plan included and provides pain management for him around the clock.
The dosages and frequency of administration are part of the Geriatric Acute Delirium Plan and the PRN medication plan for elders greater than or equal to 70 years. These order sets may be found among the electronic order sets available.
Okay, I'll get right on that. By the way, Mr. Knox's temperature was up after we took his Foley catheter. His urinalysis showed an elevated white blood count, and we are still waiting for the result of the culture. But Dr. Johnson started him in Cipro for urinary tract infection.
Well, that's good to know since infection is another common cause of delirium, but there are still a number of other things we can do.
The non-pharmacologic nursing-based interventions shown here both prevent and treat delirium more effectively than medications alone. These include a focus on mobilization, hydration, and nutrition. The Geriatric Acute Delirium Plan addresses these interventions and may be found in Mission Hospital's electronic record.
And there's still a number of things we can do, like get him up out of bed every day for each of his meals, make sure he gets plenty of liquids to drink. And do you know if anybody in his family has completed the elder care form?
I don't think so. At least I didn't see ones on his chart or in his room. Where can I get a copy?
Dealing with the elderly population in the hospital setting can be a challenge. They come to us with decades of preferences and habits. Making a connection with a total stranger in a single shift can be difficult. When any of these items are acknowledged in the daily assessment or admission tools, the personalized elder care form is automatically printed out.
Remember to take also a copy of the delirium guide for his family, and it can help them and the rest of the family recognize symptoms of the delirium and respond to them appropriately, whether he's here in the hospital or at home.
Miss McCall, I have a form I'd like you to complete.
Okay.
We call it the elder care form. It is really a very good form that would help us know your dad better, what he likes. Well, it is the things that what he does at home.
Well, he seems to be resting a little bit now, so while I'm eating my lunch, I'll fill this out for you.
That would be wonderful. That would help us a lot.
Tools, like the personalized elder care form, are among the ways we meet our patients' needs.
You know, Alice, filling out this form really got me to thinking. Dad's a veteran from the end of World War II, and he usually doesn't tell us when he's having pain, even though his arthritis can get pretty rough at times. And he just believes he should just stick it out and it'll go away, and he doesn't like to take anything for pain. But when he's having pain, he does get really fidgety and restless, even at home.
Like right now?
Like that. And then he rubs his knees, or he rubs his hip, or he moves his legs a lot, and then we give him some Tylenol, whether he wants it or not.
Well, we'll reevaluate about the pain medicine, what he's receiving, and I'll check on that one.
Pain management options include round-the-clock administration of regular Tylenol with additional doses of Tylenol with oxycodone while the patient is awake to help control more intense discomfort and keep the patient mobilized, thus helping to prevent pneumonia. These administration schedules are available to all elderly patients once the selected plan has been initiated.
Also, it said here in this form that he likes buttermilk.
Yeah,
We can
he
definitely
does.
give this to him.
Uh-huh.
And from time to time, give him some water,
Okay. I can do that.
And sometimes that, not drinking that much, a lot of water, it would contribute for, a bladder infection.
Oh.
Yeah,
Do you think he has a bladder infection?
Well, we are not sure yet.
Mother's also concerned that he's going to become constipated. He hasn't had a bowel movement since before he fell and came to the hospital.
How many days the last time he had?
Probably 4 or 5.
Okay, sometimes that would contribute also for the confusion. We'll get him on a bowel regimen. We have that one in our hospital. And I noticed, where is his glasses and hearing aid?
Oh, Mom was so worried that in the hospital they'd get lost that she didn't want to bring them, so they're still at home.
Do you think somebody can bring this over this afternoon?
Well, I'll call her and see if she's coming and if she can bring them.
And by the way, I brought you some information. This is about delirium.
Oh.
This way, that would help you and your mom taking care better. The signs, the symptoms that you have to watch, and what may contribute about the delirium. I think that's a very
Okay.
good information of that one. Oh, Miss McCall, I noticed you're kind of getting so tired. I bet you've been here all night.
I have. I'm just so afraid he's going to fall or something's going to happen to him, but I just don't know what to do.
Mission Hospitals is committed to preventing falls by promoting a program of purposeful rounding. Nursing staff take the time to make contact with each patient at least hourly during the daytime hours and every 2 hours at night. Issues of pain are addressed quickly and appropriately. Personal possessions and essential items like tissues and telephones are within reach. The patient's position in bed or chair are comfortable for him or her, and trips to the bathroom are encouraged at regular intervals. Confusion in the elderly patient rarely has a single cause. Being able to accurately assess your patient's specific situation is essential in giving complete patient care. Carefully evaluating medications, pain levels, vital signs, and changes in elimination habits can help identify sources of confusion. Making sure patients have their glasses, dentures, and hearing aids available keep the patient more clearly aware of what's going on in their surroundings and help improve outcomes for our elders.